Good afternoon again, ladies and gentlemen. I see a gentleman here. I'm Jacquelyn Fisher Marzan. Yes, I'm an advanced practice nurse practitioner with GYN Oncology here at MD Anderson Cancer Center. I've been a registered nurse for over 31 years and a women's health nurse practitioner for 23 years and get it right. Yeah, and then a nurse colposcopist, which is majoring in abnormal pap smears or specializing in abnormal pap smears for 21 years. So I've always been in women's health. So today we are going to have a candid discussion on vaginal health, common issues that cancer survivors may face, and not all discharge is a yeast infection. The objectives of today will be to recognize the common symptoms of vaginal discharge, identify the difference between normal and abnormal, and review treatment options. So the big question is, what is a normal vaginal discharge? Is there such a thing? Here's my laser pointer here. The areas that we will be discussing, we'll be talking about the uterus, the vagina, which this vagina here shows some vaginal discharge. Some of the slides may be a little too much for you. But again, it's all part of the natural course of being a woman. Um, they there's these over here are the fallopian tubes, and then you have your ovaries. So this is the area that we will be concentrating on today. What types of discharge are there? There are various types of discharge. Um, Most discharges associated with inflammation can be infection. It could be a change in the female reproductive organs. Thank you. A white normal discharge, or I'm sorry, a normal vaginal discharge is odorless and scanty in amount, not too much, and it does not cause any symptoms such as any itching or staining. If I were to walk you through a 28-day menstrual cycle when we still had our menstrual cycles, excuse me, day 1 through 10, our vaginal discharge may be a little, just a small amount, white, maybe clear. When we ovulate, so anywhere between days 12 to 16, that's when you'll notice the discharge is more thin and slimy, and it can create it makes it a more favorable environment for egg implantation if we were trying to get pregnant. Right before our periods, day about 23, 25, the discharge would thicken up. Day about 27, 28, right before our periods, the discharge may be brown. And that could be consistent with getting ready to get our period. um, a greenish color discharge can be associated with a an infection or a sexually transmitted disease. A yellow discharge, most likely it's a sign of an infection. The yellow color is due to pus and it's mixed with mucus. Again, the brown discharge, it all depends on the situation. The color brown can be due to clotted blood with mucus. Sometimes it's indicative of some type of reproductive tract bleeding. Also, it can be, you can notice a brownish colored discharge after you might have had surgery, um, any kind of procedure. Because what I usually tell people is brown blood is good blood. It's telling us that the process is healing. You don't want to see any bright red blood after surgery, that is. When the discharge is white or milky white in consistency, it could be thin, odorless. Watery discharge and itching can be due to vaginal candidiasis, which is another word for yeast infection. So I'll use that word interchangeably, candidiasis and yeast. A curdy, cheesy-like milky white discharge can be due to vaginal thrush or yeast infection. If you have any of the following discharges or discharge the following symptoms, you need to be seen by a medical provider. If you have itching in the vagina, a burning sensation, pain during or after sex, pain in the lower abdomen, heaviness in the abdomen, or backache. When we review the makeup of the natural vaginal flora, the main bacteria that's in the vagina is called lactobacilli. Now we have yeast and bacteria, I always say, that live together. If the pH goes up too high, we get a bacterial infection. If the pH goes down too low, we're more prone to get a yeast infection. So lactobacilli lives in the vagina. It's the predominant bacteria that's in the vagina, and it produces what's called lactic acid, and that helps to maintain the pH balance of the vagina. The pH balance of the vagina can be anywhere from 3.5 to 4.5, and this also helps the bacteria from attaching to the side wall of the vagina. Now, with a normal vaginal discharge, again, whitish, has no odor. The pH range is about 3.5 to 4.5. And it also is enhanced by cervical mucus that comes down into the vaginal discharge. So if we look at this, this is a normal epithelial cell. So this is a normal vaginal cell. If you see here, it's pretty clear. It's clear, and this is the nucleus of the cell. So when we look at a cell under the microscope, and then these little rods, those are lactobacilli, or the good bacteria in the vagina. Now, when the vaginal discharge is stained, this shows this is a good vagina because it has a lot of good bacteria in there that's helping to keep the normal stasis. This is the nucleus of the cell, and then that's the cell, rest of the cell there, and this is a portion of it over here. So again, there's good bacteria in the vagina. The bacteria in the vagina is probably more than anywhere else in the body other than the bowel. But again, there's a reason for that bacteria in the vagina, and it helps to maintain the healthiness of the vagina. If the pH balance of the bacteria is disturbed, it can lead to an infection or inflammation. Again, bacteria called lactobacilli help to keep the vagina's pH balance at its normal level, which is less than 4.5. And this also, maintaining this good pH level right here helps to prevent the growth of other organisms, which we'll talk about in a little bit. When we talk about the pH of the vagina, if the pH in the vagina increases, it gets less acidic, and the quality or amount of the lactobacilli, so the good bacteria, can decrease, and other bacteria can multiply. This can result in infections such as a bacterial vaginosis or thrush, and can cause symptoms that include itching, irritation, and abnormal discharge. Basically, this slide here just talks about how do we just keep that area clean. So when we talk about the labia majora, that's the outer lips of the vagina, of the vulva. When we talk about the vulva, it's the labia majora, then the labia minora, which are the inner lips. And as we've always been told since we were younger, to always wipe from front to back. By wiping front to back, that takes the bacteria, does not bring the bacteria forward into the vagina if we were to wipe from the rectum forward, because you don't want to get stool or any kind of feces material in the vagina, because that can change the pH and cause more of an infection as well. So again, it's basically just wiping front to back, and of course washing with the inner thighs when you're taking a shower. To and some people want to go all over with the washcloth, but it's basically just washing from the inner thighs on down. I've I'm sure you've heard the term that the vagina is a natural self-cleaning oven, as it says. So basically what happens is the pH, the normal yeast that's in the vagina and the normal bacteria in the vagina helps to keep the pH steady. Okay. And that helps us to maintain a vaginal pH of 3.8, 3.5 to 4.5. Now, when you use certain types of soaps, or when it says the slide says harsh chemicals, any type of like body wash, things like that, which we'll talk about, that can cause a misbalance in the pH in the vagina and can turn into either infections or continuous irritation. Vaginal washes. There's summer's eve, and you'll go through, I always walk down the aisle in ShopRite, and you see all the different feminine products that are out there. Do you need to use a vaginal wash? Do you need to douche? No, you don't. So basically, if you do a douche or use some of these vaginal washes, what that can do is change the pH in the vagina and put you at a higher risk for an infection. Again, soap and water is the best way to keep the area clean. Soaps are alkaline or have a low basic area component. I usually tell people to use something mild like Dove Sensitive, because with Dove, that's doesn't have as much perfumes in it. If you use something like Dial or Safeguard, yes, it's going to help to keep you clean, but it can also change the pH in the vagina. And this slide just reiterates what I just said, that many soaps can be harsh and can cause irritation, and just to use a gentle pH balance cleanser that can help protect against yeast and bacteria. I shouldn't have to say this, but I'm saying it just in case. Because some people may change their clothes and jump right back in the same, clean up, take a shower, and put back on the same clothes that they had on before. You don't want to do that, because if there's any type of old discharge or bacteria on your underwear, that can cause an infection as well. So you want to make sure that you use a clean pair of underwear. And sometimes after taking a shower at night, or when you're going to bed, I usually say sleep without any underwear on, because that helps to keep the area nice and dry. Menopause and vaginal infection. So basically, vaginal infections are more common among women of menopausal age, and this is due to the change in the vaginal estrogen levels. These levels can change either premenopausal or postmenopausal, but basically what happens is a drop in the estrogen level can cause the lining to be thinner and drier. Now, there are different types of menopause. There's physiologic menopause, which is the natural way that we go through menopause when we get a certain age, could be anywhere as late as 55, as early as 45, 47. And menopause is defined as not having a period for over 1 year. If you go a year and 2 months, 1 month, and you have a period or a bloody show, you need to be seen as soon as possible, whether you go to your GYN or to the clinic, and tell them that you have had a period, and, try to keep track of the last date that you had your period. And an endometrial biopsy would be performed, and that's to get a sample of the lining of the uterus to make sure that the uterine lining did not overgrow. And if you're not make sure you're not at risk for developing endometrial cancer. So that's natural menopause. Then there is surgical menopause. That's what we go into when we have a hysterectomy. Again, a hysterectomy can consist of just having the uterus removed or having the ovaries removed, anything that causes the period to stop. And then the third type of menopause would be a medical menopause, which would be certain types of medications, chemotherapy, things like that will shut down our periods and we won't have a period. But we know the reason why we're not getting a period, and it's secondary to the medication. With menopause, the vaginal walls become more delicate and are more prone to cracks and tears. The vaginal wall is very, very thin. And when that occurs, it can cause, if you're still sexually active, it can cause cause some burning with sex. Or if you're using a vaginal dilator, if you've had uh, radiation, we do encourage you to use the dilators, because otherwise, if not, the vagina becomes what's termed atrophic and scar tissue can form, and it can cause your vaginal walls to shorten. So you always want to use a lubrication that you can get over the counter. Either, there's KY Silky, KY Liquid. I usually say when you look at something like the gel or the jellies, that's more tacky and sticky, and that's basically kind of similar to what we use when we do an exam. But you want to use something that's a little smoother. You don't want to use any kind of like baby oil or Vaseline, because that can hold on to bacteria and put you at risk for an infection as well. So again, let's talk about some common causes. And the two main ones that I'm going to talk about is bacterial vaginitis and candida vaginitis, or yeast infection. So this says BV, which is bacterial vaginitis, but when instead of saying candida vaginitis, I'm just going to term it as yeast for today. So with BV, these are certain risk factors that can cause the pH to increase and put you at risk for a bacterial infection. That would be douching, smoking, IUCD. What is that? No, that's an intrauterine contraceptive device, such as an IUD. If you have multiple sexual partners or unprotected sexual intercourse, if you use higher doses of spermicide, which has naloxone 9. So sometimes with certain condoms, certain there's the vaginal ring, there's different types of birth control methods that can have a high concentration of naloxone, naloxone 9, which can cause irritation. Again, shower gels, antiseptic agents, and shampoo in the bath. So we all love our Bath and Body Works, and I tell everyone you can use your Bath and Body Works, but use it on your body. But in the vaginal area and vulva area, just use normal soap and water. Or if you're in the shower, just use water just to help clean the area. With a yeast infection, antibiotics is the major cause of a vaginal yeast infection. So you hear people say, oh, I'm on antibiotic, I got a yeast infection. And why is that? When we take an antibiotic, let's say we're taking an antibiotic for an ear infection. So it's going to kill the bad bacteria in our ear, but it's also going to kill off the good bacteria in our vagina. So when that occurs, the pH in the vagina drops down and makes the vagina a more favorable place for yeast to grow. Very common in patients who are diabetic, but their sugars aren't controlled. Again, douching or local irritants, perfume products. This is the number one, the other, I guess it's the number two, but one of the main causes of a yeast infection, tight fitting synthetic clothing. So, all you young ladies or ladies out there who want to wear your thongs, your your tights, you got to let the area breathe, okay? So, basically, what you want to do is when people let's say you're exercising and you're sweating and the yeast likes warm moist areas, so the wet underwear is pressing up against your vulva, and then you have your tights, your workout tights on, spandex, and you work out, and then you're like, oh, let me go run a few errands. You go to the store, you go food shopping, you get gas, you're running all over the place, but you're still having those wearing those wet clothes. So what happens? The yeast, again, yeast likes warm, moist areas, so it's making it a very favorable environment for yeast. So then you'll take off the wet clothing, get ready, get in the shower, and then you go to wash, oh, so it feel a little tender. That's because the yeast is starting, the pH is changing and it's starting to form a little bit of yeast. So the main point of that is work out, take an extra pair of underwear or an extra pair of pants and change before going out and running around doing your errands. Again, this is just talking about common causes of BV from our perspective. When we're looking at it, the discharge may be gray, it may be sticking to the vaginal wall, and the odor may be like a fishy type odor. And when we do a wet prep, which a wet prep is, we have a slide, we get a sample of the discharge with a Q-tip from your vagina, and we put it on the slide, and then we put a drop of what's called potassium hydroxide, and that produces a chemical response that's causes amines to emit an odor that's a fishy type odor. Okay, we're very graphic here now. So this can be what vaginal bacterial vaginitis looks like. These are the labia minora and the labia majora are out on the outer side here. And when we look in at the speculum, we may see some discharge coming, pooling around the cervical opening, around the cervix, I'm sorry. When I was talking about the wet prep, if you remember going back to that first slide when I showed you what a normal cell looked like, so this is that same cell, but see how small the nucleus is here? And the bacteria has taken over the cell. So the clue, as it's called a clue cell, is the bacteria actually adhering to the cell here. This is a gram stain of it and shows exactly the same thing. All of this, the dark purple, that's bacteria. And as you can see, it's adhering to the cell, the normal cell. This is all bacteria. And this just shows how we just do the whiff test. So yeah, back in the day, yeah, we had to sniff the Q-tip, and that was just part of a natural thing. Sometimes we can smell the bacteria, and you might know if you've had bacterial infections quite frequently. Some people will call and say, I've got that discharge and that odor again. And, we walk through it. But again, a surefire way of finding out, is it yeast or is it bacteria or is it something else? We will do a culture. That's the easy way to do it nowadays. Second common cause is Candida vaginitis, which is, there are 3 different main types that can cause yeast infections: Candida albicans, tropicalis, or glabrata. So when we talk about the 3 different types of yeast causing factors, when we talk about the treatment, there is Monistat that's over the counter. And then, I'll get a call. I got a yeast infection. I tried Monistat, but it didn't work. That's because Monistat may only work against one type of this candida, whether it's albicans, tropicalis, or glabrata. So that's why a lot of times we will order something prescription like Terazol or diflucan. Again, it goes over the risk factors such as altered immune status, increased blood sugar levels, and that can cause a decrease in the normal bacteria or the lactobacilli. Again, most of the itching, the diagnosis can be itching and burning, vulvar burning, painful intercourse, vulvar dysuria. So basically, when you're urinating, you get burning on the outside of your vulva. When we do an exam, we can see redness or erythema, sometimes swelling. The whitest discharge, again, it's like a curd-like consistency or cottage cheese-like, and the pH can sometimes be normal. And this is, I'm sure some people have had yeast infections, some people may have not. So, but this is what yeast can, when you wipe and you see that thick, clumpy discharge, and if it's itching. So here she has some irritation, it's swollen. So that's the edema that was on that last slide. Erythema, which is redness, and that's just the vaginal opening with discharge there. When we do a wet mount for yeast, oh, I'm sorry, I want to go back. When we talk about itching and burning, not necessarily is it a yeast, depending on what treatment or what diagnosis you may have. It could be, as a gynecology, oncology, we want to make sure that it's not any type of vulvar cancer or vulvar dysplasia. Just like you have an abnormal pap smear, you can have vulvar dysplasia. And sometimes there's a term that's called lichen sclerosis. And with lichen sclerosis, that's a thinning of the tissue. Sometimes the tissue on the vulva becomes very thin, and it can be white, have like white streaks. So it's always, how do we differentiate between vulvar cancer versus vulvar dysplasia versus lichen sclerosis? We take a biopsy. So you might not like me after that visit, but then you'll like me because I'll be able to give you a definite diagnosis as to what was causing that itching and irritation. So when we're talking about yeast, when we're looking at a wet mount or with the potassium chloride, which is when we use the potassium chloride on the slide with the bacteria, remember it caused the clue cells, and it caused all the adhering of the bacteria on the cell. Now, if you have a yeast infection and we use the potassium hydroxide on that, the KOH or potassium hydroxide kills the bacteria and cells from the vagina, leaving only yeast. And it's easier to detect the yeast because the yeast gives us spores, which is, pseudohyphae. It's called hyphae. The spores are the little round buds right here. When I was in school and learning about this, we used to look for what we called snowmen and they would actually be piled on top and kind of look like Olaf from Frozen. But it was like, look, he looks like Olaf right there. I just saw that. But anyway, sorry, I got a little distracted there. But yes, we would look at it as if they were snowmen because they're just little buds on top of each other. And then we had the hyphae, and that was easy to detect. So, in summary, regarding yeast, normal discharge, and bacteria, a yeast infection is not sexually transmitted. The discharge is thick, white, and cottage cheesy and cause some itching. Again, treatments can be antifungal vaginal creams or pills. So if you try Monistat and that does not work, or anything over the counter, now if you try that Monistat ovule, it's going to burn because your vagina is already raw and irritated from the yeast. So that ovule has a large concentration of medication in it, and when it dissolves, you get that sudden burst of that medication. And a lot of people do indicate that it's it causes more burning and irritation. Some people will call and say, I just need a diflucan. Okay. So if or I got a diflucan from my primary doctor, but my yeast hasn't gone away. And that's common because diflucan or fluconazole may only attack one species of the yeast. So sometimes you need two. So the way we treat basically is you take one tablet today, and then you would take another tablet in about 3 days. And sometimes I double dose it. I may give you, if it's a really bad yeast infection, I will give you Terazol 3 for 3 nights. And it's best to use any kind of anti-vaginal cream or an estrogen cream to put it in at night before you go to bed, because that way it can pool in the vagina. Because if you put it in during the day, it's just going to run out. So when you're laying down, that medication is going to stay in the vagina. Non-infectious vaginitis, not sexually transmitted disease, not sexually transmitted, I'm sorry. The discharge will be increased. It can cause some itching or burning. And again, this could be secondary to body washes, different types of soaps, or birth control methods. With bacterial vaginosis, again, very unlikely that it's sexually transmitted. There's been some research on that. But with the discharge is milky white and thin, and the main telltale sign of that is a fishy odor, and especially after sex. What happens is sperm is basic, so if he ejaculates into your vagina and you have a bacterial infection, afterwards you're going to have that fishy odor, and it's not pleasant after. So just let you know. So we would prescribe an antibiotic or an ointment. So the main antibiotic that we use is called metronidazole. With metronidazole, that is good for you take one tablet twice a day for 7 days, and then if but you can't drink any alcohol with it. I think I might have said that. I'm not sure. Um, or if you can't take pills, or you get that nasty taste in your mouth, because it can give you a metallic-y taste too. There's Metrogel. It's just like um, having a yeast infection. You use the vaginal applicator, insert that in for 5 nights.
One of the questions is for Jackie. Do you have any recommended treatments for dry vagina?
Well, it depends on what you were treating. If it's menopause or estrogen related, then we would recommend an estrogen cream. Some people, there's a fear that if I take estrogen, it's going to cause cancer. Well, if you've had a hysterectomy, the risk for cancer is very minimum or gone, because your uterus is gone and there's no risk of having an overgrowth of the uterine lining. But with estrogen, the estrogen cream is localized, so it goes directly into the vagina, and it helps to coat the vagina and bring back the healthy tissue. Does it get into the bloodstream? Not necessarily. Minuscule, probably less than 1%. but the risk of a blood clot is very, very minimal with using an estrogen cream. Otherwise, you can, for vaginal lubrication, there's, now I'm not, supported by any of these products, but there's Replens. With Replens, that's a vaginal ovule that you put in your vagina. I think it's 2 to 3 times a week, and that helps to bring back the vaginal moisturization. And there's Refresh, which Refresh is supposed to help to maintain the balance of the vagina. And then again, there's just over the counter, the KY Silky, the Vagisil, things like that.